Welcome, and thanks for joining us for this edition of Scope. The Eastern Highlands Provincial Health Authority is well prepared with its COVID-19 strategy because its preparations are done after carefully observing the COVID-19 virus trend and the different variants since 2019. During a visit to Goroka General Hospital in July, Director for Public Health in Eastern Highlands, Dr. Max Manape, spoke of the readiness of the Eastern Highlands EHPHA, the challenges and the supporting institutions like Medical Research Institute to combat the disease.
Dr. Max Manape took the opportunity to talk to the media about the COVID-19 in the Eastern Highlands as well as the impact it had on the routine immunizations, the challenges faced and how they tried to address the issues. The Eastern Highlands Provincial Health Authority has a solid COVID-19 strategy because it has been observing the trend of the virus and responding with countermeasures.
In 2019, when this COVID-19 was, discovered, and when they start telling us through all medias and through NDOH and WHO, the Eastern Highlands Provincial Health Authority set up all these facilities.
Goroka Provincial Hospital was physically divided by a cyclone fence within its boundary. In doing so, the primary healthcare section was moved from the hospital setting to two urban clinics outside of the hospital, including the antenatal clinics, so that the primary healthcare clinic was converted to a COVID-19 facility.
So at that time, we detected, the first case that was detected was in Morobe. Following that case, we detected one female from Eastern Highlands got that COVID-19 into the province. So at the time, we put up all the interventions to really, and our surveillance team was on top. Because we have already trained a lot of our surveillance officers, they were on top of contact tracing, following up, testing. And then from that, in 2020, we have recorded only 13 cases. One case from Asaro and 12 cases from Goroka Town or Segu area. So that was only 13 in 2020 with no deaths.
Alarmingly, in March 2021, the province saw a surge of COVID-19 cases, with numbers jumping from just 13 cases in 2020 to over 700 cases from March to May 2021, with 14 COVID-19 related deaths recorded. Eastern Highlands Provincial Health Authority went ahead to set up a COVID-19 response committee comprising of technical people to make decisions on the response strategy.
So we assigned a lot of people to set up all these facilities around in the hospital, while at the same time too, we were trying to set up in the districts. But district was a big challenge for us because of limited funding, and not much support was coming from the DDA, and that's the whole reason our district was a big problem.
An impressive COVID-19 setup of the facilities, from surveillance to testing to diagnosis to inpatient wards for recovery, and if otherwise, the hospital also modified two containers to function as the special mortuary. A well-set-up facility does not solve all the problems though. Having sufficient oxygen supply is essential for COVID-19 patients, with partners like UNICEF, NDOH, and WHO assisting with oxygen concentrators. The hospital is able to move on to other essentials.
So now the major support and major treatment for those who are admitted in the hospital was oxygen and steroids. So these are the basic things our doctors were really dependent on for the treatment of our COVID-19 patients. So a lot of patients who were admitted were successfully treated and discharged. But then unfortunately we lost 14 of them, those who have the underlying diseases.
Realizing the limitation of resources and manpower, the Provincial Health Authority wanted to be proactive about combating COVID-19 as well as other communicable diseases in the communities. They took to creating awareness and advocacy throughout the districts.
Now from June, mid-June to now first week of July, now we are seeing the cases now reducing. Is now declining. You can see, we no longer have a lot of cases now admitted. So 2 or 3 cases are admitted here. Now in the stable ward, we don't have any now. Our screening used to be a long queue of people for screening, is now reduced. So it's basically now we are seeing the number of COVID cases in the province reduced.
Prevention is better than cure, so the saying goes in health. The Eastern Highlands Provincial Health Authority is not being complacent. It is moving forward with advocacy and communication messages of prevention of COVID-19 and other diseases.
And in Eastern Highlands, we are really trying to get the COVID-19 vaccination to all the districts. And we have set up, in every 8 districts, we have set up a facility for COVID-19 vaccination on AstraZeneca vaccine. Because why the government use AstraZeneca vaccine? It's very, in infrastructure, we can able to put it in line with our normal routine vaccination. But if others like Moderna or Pfizer vaccine come, we don't have the facility to really keep that vaccines because they require almost minus 20 degrees fridges, but that we don't have it here.
Dr. Manape said mostly the expatriate community and some who understood the benefits of vaccination came forward to get vaccinated. However, the bulk of Eastern Highlanders, including health workers not coming forward, the PHA is faced with a big problem.
Get the vaccination. So we sent up a team to set up the, have advocacy meetings. So we set up advocacy meeting among the health staff for 3 times. The number of attendance to that advocacy meeting was very poor. The turnout was very poor. It was quite disappointing, but we kept 3 times, nothing went to it, so we called for another wider one, which involving the health workers, the police, CIS, the pastors, those frontliners.
But the attempt was poorly responded to, so they re-strategized. They started going to the communities, starting with the public servants, then corporate bodies, and it has proven to be effective. Dr. Manape said it is possible for people to be immunized when they are well informed and when they are met at their level with information that dispels the myths and misinformation.
Compared with other provinces, I think Eastern Highlands, we are more advanced. We have already set up every facility. It's just ready for any cases who are coming in to be managed and discharged.
In Eastern Highlands, myths and misinformation about the COVID-19 vaccination has affected the routine immunizations. Mothers were reluctant to bring their children for immunization. However, when the COVID-19 response advocacy team started to roll out the awareness and advocacy to the districts, people volunteered to get vaccinated because they were well informed.
When we come back, a story away from the hustle and bustle of the industrious city of Leh, a small-time entrepreneur and his family work side by side to run their tourism business. Why travel out for vacation or holidays when paradise is just a boat ride away? A locally run lodge at Salamaua in Morobe province promises breathtaking scenery, pristine waters, and a stress-free atmosphere.
Buagong Lodge is located at the untouched seaside village of Busamang at Salamaua. It is only an hour-long boat ride away from the congested and polluted Leh city. Owner of the lodge, Guring Moari, has his own boat and uses it to pick customers. His first building, consisting of 2 rooms upstairs and a kitchen underneath, was erected in 2013, while he got his first customer in 2014.
We disinfect guests and people man come no man Mary come no Switzerland or they come for visit lo Papua New Guinea or they come over some honeymoon lo to plus. So that was my first guest. And after that, and more mainly all missionaries from all different churches lo Leh or say come no here. Or they come also more panim to sahab no or to all like some place no relax enjoy was or something. So all spreading words over the missionaries number lo Goroka, Montagen, some Rahab, land lo Leh, all we train when we call Brotherhood Church, some churches number. Mostly I'm more land long Germany, Switzerland, we got man from Canada, US, Australia, or missionaries all stuff long lay more lay na other places in the United States and check come na.
In 2015, his new setup was booked to host a children's camp where Moari was expecting 18 children and 10 adults.
What we okay, we must go buy more mattresses, bed sheets, pillows, over something enough to feed him this 28. So at the moment, we got everything what a guest house needs.
The friendly Busamang man, who is now in his 60s, has over 3 decades of experience as a safety and environment officer in the mining industry. His skills have enabled him to keep the place running since his retirement in 2014. Moari built his lodge from scratch, from obtaining materials to installing electrical wiring and plumbing. Because Salamaua is yet to access electricity, a generator and solar lights ensure the area is well lit at night. And if the generator or the boat are having problems, the local businessman and his boys get them up and running in no time. His wife and daughter-in-law are in charge of housekeeping and catering, while his son and nephews accompany him on his trips to and from Lae, as well as maintain the property. Business has recently been picking up. Hence, Moari is planning on adding more facilities as soon as funds are available.
After the break, more people affected over Jack Piddick Park dispute. The dispute over the Jack Piddick Park between TST Group and the National Capital District Commission has now impacted income-earning activities for second-hand vendors of the Yakapilin second-hand market. The vendors are now asking NCD Governor Powes Pakop to intervene with an alternative market space so they can continue their retail business.
300 clothing vendors who sell second-hand clothes at the Yakapilin shelter at Jack Piddick Park on portion 2192 were given a verbal notice or warning on 15th of August and evicted the next day, the 16th, by hired police and security guards. On the 17th, the entire area was fenced, all in just 48 hours. The land space of portion 2192 is understood to be owned by the TST Group and used by Port Moresby Vendors Association, which has more than 5,000 men and women, had an agreement with the National Capital District Commission through NCDC Governor Powes Pakop to sell their second-hand clothes there since 2008. According to the vendors, there was no ample notice given to them to move out. Lawyer representing the association, Brian Lakakit, said the vendors were not given ample time to move out. He said vendors are now displaced and NCD governor must address this.
The people here, you can see, are the vendors who conduct their business at the Yakapilin market, fly market, okay, in portion 2192. They operate under what is a company or an association by the name of Port Moresby Vendors Association. It's comprised of more than 5,000 people, including women and children. So the purpose of this meeting is to put their grievances to the governor, because they were anticipating the governor to address them on the issues affecting their livelihood. That the vendors have actually conducted their business through an arrangement with the NCDC. So they've not been people. Some people may perceive that the vendors were there illegally, but that is not correct. They've been there following an agreement. These are formal vendors. They conducted their business starting at Gordon's and followed by Baroko, and about 2008 they moved into Yakapilin market, and they've been there for some 12 years now.
Clothing vendor and mother of four, Nancy Apakali, said she is worried for her children's well-being because she has lost her business and a great money-making venture.
This line no farm can live na mimba futim lo street. This line no coconuts na mimba harem go la house to blomi. Second hand bail 200 kg hard lo habim na harem go. Ogra something I'm lost. Ogra something I'm lost. Lost. Art lo mimba go kiss him. Ogra school beginning lo mibla. Mika 6 lo beginning. First one lo mi lo Gordon's grade 9, grade 10 this year. Emba hard lo go school start lo house back. Na tripla lo coronation lo iya. Emad lo go.
Former president of the Vendors Association, Johnson Canagan, said they believe there is a court order in place, but people need to understand that lives have been affected.
We are very saddened by this, and this is the first time it has happened to the Vendors Association. The mothers and the people here fight for their market, and they know how to fight. But, we thought that there will be a notice, and we will be given. We did not react to the fence that was on, although we know that there was a court order. But a day later, there was a stay order coming, and the stay order was not respected. So we did not communicate very well with TST. We did not. We understand that they will give us ample time. There was no ample time. All our stock, all our buildings were were pulled down by hired security, hired policemen, and hired people. We, in this nation, is Papua New Guinea, they're all blacks here, and this is our land. It's not Yakapilin only benefiting, all Papua New Guinea living in Port Moresby. So we are very sad. We are becoming like a foreigner in our own land. We must be given ample time. So it's a sad day for the residents of Port Moresby. It's a sad day for the mothers that do their vending here. It's a sad day for all of us.
According to Nancy Apakali's grievances, is Lucy Sengi, the SME women's representative, added that all district members of NCD, including the governor, need to come together and find a solution and a suitable location where they can start up their second-hand business, as it has immensely affected them and their families. Having lost a large number of their second-hand bales, the future of their retail business remains gloomy. They are unsure of who will compensate them for loss of business. The land in question, portion 2192, has been in the courts for the past 30 years. The land was formerly under the Boy Consultancy Services Limited, now known as Capital Centre Limited. Boy Consultancy Services had acquired the A 99-year business lease on the 14th of April 1991 for portion 2192 in exchange for a parcel of land given to enable extension of Port Moresby General Hospital.
The government at the time, through the minister or the lands department, decided to trade off Jack Piddick Park without consulting NCDC in exchange for that land. And this is the situation we are faced with now. It's a legacy problem.
Governor Pakop also said the court order relied on by Capital Group, granting approval for the fence and the survey plan of the area CAT or CAT 49 1882 to identify boundaries, a survey he claims does not satisfy the court order, but one that was only used to grant the title.
Because the situation is that when the title was created in 1991, it was not properly surveyed. The title clearly shows that it says, and everybody accepts, including TST group of companies, that this title is subject to survey. So all this time we've been waiting for the Surveyor General to go and do a proper survey, verify the survey, so that we can work out what belongs or should go to TST group of companies in whatever name, Capital Centre Limited or Boy Consultant or whatever they're packing the title under.
He added that the land is currently zoned as a recreational space and the title holder is intent on developing it commercially. Thus, the NCDC Physical Planning Board, of which he is chair, cannot approve it. But this did not stop the said title holder of the area from fencing in the area. TST Group used a statement immediately after to say the public has been misinformed. The statement goes on to say the Jack Piddick Park name came about illegally after the title had been granted to TST in 1991, where the then Namalu government requested to exchange the land space for one which now accommodates the Port Moresby General Hospital. That is, Pomgen was built on the land they owned in exchange for Jack Piddick Park, but for 30 years TST had been denied the use of the park space. Lawyers representing the aggrieved party presented documents pertaining to the land and explained for the need for fencing around the land space in question.
In the court orders, the court declares that portion 2192 is the registered property of Capital Centre Limited. The court also ordered that anyone on the property should give vacant possession to Capital Centre Limited within 45 days from the date of the order, which is 19th May 2021. In the nature of a permanent injunction, the defendants, their servants, associates, agents, and associates are restrained from entering onto and enjoying the land unless upon written authorization from Capital Centre Limited. They are also restrained from intimidating, harassing, abusing, physically interfering, and threatening its Capital Centre Limited, its servants, associates, agents, or invitees. So that covers what is happening on site now. No one should be allowed to go onto the land and interfere with the fencing that is going on. It is ordered by the court. The court order is contemptuous in nature, and so all parties in this proceeding are supposed to comply with it. So our client is also just complying with the court order. So if there is anything that needs to stop, it needs to come from the court, because we all have a court order to comply with. Yes, I can confirm that all these documents were attached as court documents in an affidavit that was filed in these proceedings, and NCDC was represented by their principal legal advisor throughout the entire court proceeding, mediation, and later service of these documents were also duly made on NCDC.
A copy of the surveyor's report from the Office of the Surveyor General dated 10th of May 2021 was also presented, stating that the land was acquired illegally and the NCDC does not have legal rights under the Land Act 1996 and the Survey Act to encroach into any developments without identifying legal boundaries, a title that was awarded to Boy Consultancy Limited, now Capital Centre Limited, was also presented. Unfortunately, NCDC has put words into action and has demolished the fencing. Governor Pakop had initially said that the fencing around the land space would be demolished because the powers to put up any physical structure in the city over 3 meters, including fences, remains with the Physical Planning Board. He said the courts might have granted Capital Centre Limited leeway of the portion, but they have not suspended the board's powers. On 24th of August, NCDC demolished the fencing put up by TST Group surrounding the Jack Piddick Park, with Governor Pakop present to witness the pulling down of the fence. A statement was later issued to say it is defending public interest. The governor was quoted saying it is NCDC's duty, both legal and moral, to protect public interest as well as private interest in the city. The statement goes on to say that records to date show NCDC have been fair and responsible in the discharge of its duty.
That ends another episode of Scope, a kind reminder to apply simple measures to prevent the transmission of the coronavirus. Regularly wash your hands with soap and water, cough or sneeze into your elbow, and exercise social distancing. If you are feeling sick, please stay at home. You can also call the COVID-19 hotline number for more information or assistance.